Let's talk human immunodeficiency virus. So in the retrovirus category, we have the HIV and HLTV. So retroviruses are actually the enveloped positive single-stranded RNA viruses, and they are positive stranded, so they are very much infectious. In the retrovirus, we have the HIV. Pretty easy, but very testable and high yield topic. So HIV has a diploid genome. Diploid genome means it has two RNA molecules or RNA segments. It has three kind of structural gene. First one is N gene, and N gene produce a large glycoprotein 160, which is the only protein which glycosylated into the Golgi apparatus and endoplasmic reticulum and cleaved into two proteins, two glycoproteins. Number one is glycoprotein 120, which is for attachment, and glycoprotein 41, which is for fusion and entry of the virus. If there is a N gene mutation, then the person is very much evade then the virus evade immune response, or the attacking response of the body. So after in virus N gene, we have the GAG gene, and GAG gene is responsible for P24 capsid antigen, which is used in immunoassay for detection, and also P17, which is a matrix protein. Then there is a pol gene. Pol gene is responsible for three enzyme reverse transcriptase, which helps to transcribe RNA to DNA. Then integrase, which can integrate the viral DNA into the host genome, and also it has the proteases which cleave different glycoproteins in order to give the capsid, in order to give the different proteins necessary for progeny of the viruses. So pol gene is for these three enzymes. And pol gene, if there is a pol gene mutation which is very much common whenever there is a monotherapy, then it can cause resistance against antiretroviral medications. So we always use 2 or 3 multi antiretroviral medication in order to defeat that HIV virus. Then we have a little bit about the mechanism. So retrovirus or HIV, it binds CD4 and CD4 as well as co-receptors CCR5 on the macrophages. We have discussed it in the immunology lecture for the early immune response. And if there is a homozygous mutation of CCR5, then cytokine release, and it CCR5 binding, and it can release cytokines which can cause a different serum sickness, different symptoms of in the patient. If there is a homozygous mutation of CCR5, then the person is very much immune to this virus. Virus get entry but cannot releases the cytokines and cannot give the symptoms of HIV. But if the person is heterozygous for the CCR5, then it is then the progression of the disease is very much slow. The presentation is very much in the old ages or very much late. So this is it binds the CD4. That's why the CD4 count is very likely to monitor throughout the HIV disease. So this is all about a little bit introduction of HIV. Then we have HIV immunoassays. How to diagnose HIV? There is a immunoassay technique, and which is very much sensitive and very much specific. And in this immunoassay, we detect P24 antigen and also HIV1 and 2 HIV1 and 2 antibodies, IgG. If the person is negative, it means it is not affected by the virus. But if the person is positive, then we go for differential antibodies. If the person is infected with HIV positive, infected from HIV class 1, then it gives HIV1 positive antibodies. If it is positive for HIV antibodies 2, then it is HIV2. Then if the person can also infected by HIV1 and 2 and gives both antibodies. And also there is a test result of indeterminate antibodies in which there is no detection of antibodies regarding the HIV. Then we go for NAT test, nucleic acid amplification test, HIV1 NAT test. And if this NAT test is negative, then the person is not infected. But if it is positive, then there is a acute infection. And the NAT one is actually the viral load test, and the viral load test is pretty much important in the babies, and it is used for treatment monitoring. So this is all about the diagnosis and the introduction of HIV. Then we have the 4 stages of time course of HIV. There are the 4 clinical stages. First one is flu-like symptoms. The person is acutely having the flu-like symptoms in the initial course of the disease. Then there is a period of latency in which there is a symptom-free period. The patient is feeling fine. And also in the latency, the virus is remain in the lymph node and replicates in the lymph node. Then after the latency period, we have the falling CD4 count, and after this there is a final stage of crisis. So these are the pretty much stages of HIV. Then how to diagnose HIV? So HIV, we always diagnose HIV on our criteria that whenever the CD4 count is less than 200, or if the person is HIV positive in the immunoassay result and also having the HIV defining diseases, then it is a diagnosis of HIV. So now we discuss when the CD4 count is less than 500, then the person is infected with the first one is Candida, scrapable opportunistic fungi, and then he get infected from human Epstein-Barr virus, and it can give hairy cell leukemia, which is non-scrapable lateral tongue lesion. Then he suffered from Kaposi sarcoma or human herpes virus 8, and also human papilloma virus. Kaposi sarcoma, we have discussed that, and human papilloma virus, it is anal, skin, or squamous cell papillomas. If the CD4 count is less than 200, then the person is get infected with histoplasmosis. We have discussed this histoplasmosis in systemic mycosis lecture, and also after histoplasmosis, it can infected with the Candida infection, histoplasmosis, and also after histoplasmosis capsulatum, it can also can cause whenever the CD424 is less. There is a dementia problem and HIV related dementia, microglial nodules in the brain, and also there is a JC progressive multifocal leukodystrophies, and also there is a pneumocystic cerevisiae. Pneumocystic cerevisiae very commonly tested, and we discussed this in separate lectures. So when it is pretty much easy to understand. When we have discussed this one by one, we can easily differentiate the CD4 count related age defining diseases. So whenever the CD4 count is less than 100, then there are some infections regarding. First one is Aspergillus. Aspergillus, it can cause pleurisy and respiratory problem. And after Aspergillus, the person is suffered from bacillary angiomatosis caused by Bordetella, and which gives a very dark very dark papules and on the extremities. And also after Bordetella, the person is also infected with the Candida, but this Candida is very much esophageal or disseminated. So esophageal candidiasis, having the pseudomembranes and pseudohyphae, and also the Candida related diagnosis. So after Candida, the first most common problem is opportunistic infection, or first most common AIDS defining lesion is cytomegalovirus, which gives the creep criteria, in which there is a colitis, there is retinitis, esophagitis, and encephalitis and pneumonia. After creep, we have cryptosporidium. Cryptosporidium, we have discussed this. Cryptosporidium, it is acid fast bacilli, acid fast bacteria, and it can cause the second most common. It can cause watery diarrhea. Cryptosporidium is the protozoa causing this problem. Then we have the second. It is the second most common. Then we have the pneumocystic. After pneumocystic cerevisiae, we have the cryptococcal meningitis, and this cryptococcal and Candida and Aspergillus happen when CD4 count less than 100. Histoplasma and pneumocystic cerevisiae is related to when CD4 count is less than 200. But Candida, oral Candida, and dermatological problems like warts and Kaposi sarcoma, and these problems happen when CD4 count is less than 500. So these are pretty much differentiating factor that which infection get happen when whenever the CD4 count is. But in the question stem, the significance of these counts are, the question has the stem that it tells that the CD4 count is 350. So we have a mind that whenever the CD4 count is greater than 200, then these four pathogens can affect that person. So answer is not histoplasmosis, Aspergillus, and all those stuff. The answer remain between these four pathogens. But whenever the question tells that there is a CD4 count of 150, so then automatically we can assume that the question is the answer may be from these four pathogens. So maybe Candida, maybe pneumocystis cerevisiae, histoplasmosis, dementia, and all the viruses. So this is the actual reason that I am discussing these problems categorically. So after cryptosporidium, we have the Epstein-Barr virus, and this Epstein-Barr virus is oral problem, and this Epstein virus can cause mononucleosis like problem. And after this we have the Plasma gondii virus. And there is the last category. When the CD4 count is less than 50, we have only the MAC bacteria, Mycobacterium avium intracellular or avium complex, then it can cause all the problems, because it is most commonly when the CD4 count is less than 50. So this is all about HIV, and we have left antivirals medication, how they work, and also we have left antiretroviral medication.